Hello everyone, my name is Mahmoud Ismail. I'm one of the cardiology fellows at Mayo Clinic. Today I'll be talking about our research evaluating the outcomes of left atrial appendage occlusion in octogenarians and nonagenarians. And just as a quick reminder, octogenarians are defined as those between 80 and 89 years of age, and nonagenarians are defined as those aged 90 and above. So just quick background, our very elderly population with atrial fibrillation are usually at very high risks for complications from anticoagulation, and we quite often refer these patients for left atrial appendage occlusion. And the risks of left atrial appendage occlusion among octogenarians and nonagenarians compared to clinically similar but younger patients aged 79 and below are unknown to date. So the goal of the study was to compare the clinical outcomes of left atrial appendage occlusion in octogenarians and nonagenarians versus younger patients aged 79 and below. So this was a retrospective cohort study that used the National Inpatient Sample Database to identify hospitalizations for left atrial appendage occlusion in the United States from 2016 to 2020 and to compare the clinical outcomes in octogenarians and nonagenarians versus younger patients. The primary outcome was major adverse cardiovascular events, defined as the composite of in-hospital mortality and stroke, and our secondary outcomes include in-hospital mortality, in addition to procedural complications listed in the figure in the center, in addition to length of stay and total costs. We also evaluated the trends of left atrial appendage occlusion in different age groups. We were able to identify 84,000 patients who were hospitalized for left atrial appendage occlusion between 2016 and 2020, of whom 32.9% were octogenarians and approximately 3% were nonagenarians. And after adjustment for clinical factors and demographic factors, we found that octogenarians and nonagenarians had similar rates of MACE and hospital mortality, stroke, permanent pacemaker insertion, acute kidney injury, major bleeding, blood transfusions compared to younger patients aged 79 and below. Octogenarians had higher adjusted rates of vascular injury compared to younger patients. However, nonagenarians had similar adjusted rates of vascular injury compared to younger patients. We also found that over the 5-year study period from 2016 through 2020, the volume of left atrial appendage occlusion had increased in all three age groups. The most prominent increase in left atrial appendage occlusion volume was noted in the octogenarian group as delineated here in green. So to conclude, octogenarians and nonagenarians undergoing left atrial appendage occlusion have a similar safety profile compared to clinically similar younger patients, with the exception of higher vascular complications in octogenarians compared to younger patients. Further research is necessary to confirm our findings. Thank you very much for your time, and I look forward to your questions.